Our audience here are North Carolina decision makers in business and politics.
Healthcare today is no longer confined to just the hospital or the clinic. Healthcare increasingly happens wherever the patients are, at home, at work, in schools, and in community settings. So reliable, secure connectivity has become an essential to healthcare delivery as roads and electricity is to commerce. So the organization that will thrive are those that leverage technology to extend care, improve outcomes, and operate more efficiently while maintaining a focus on patient experience.
There are a lot of pressure out there right now. And, we have some of the best hospitals and academic centers, not just in the nation, but really in the world. But North Carolinians are not as healthy as we would like them to be or as they could be. And our costs are too high. We really have what I would consider a great sick care system, that we're not investing enough to keep people healthy. We're not focusing on, how to improve health over the long term. Now, I'll tell you, I want one of Josh Dobson's great hospitals if I'm going to have open heart surgery. But what I want even more is to avoid having open heart surgery. And, we put so much emphasis on treating disease that sometimes we forget how to keep people healthy.
But I'm worried. I'm really worried about the healthcare system in North Carolina and the challenges and the policies that are being discussed and already implemented. When I think about HR 1, $40 billion over a 10-year period cut out of North Carolina's Medicaid program. That's not waste, fraud, and abuse. That's not anything other than direct Medicaid cuts to providers in North Carolina. And you can't have that level of reductions without having a cascading impact. So I'm really, really worried about that. With the enhanced premium tax credits that expired at the end of last year, it's not like those individuals will be able to make up that difference. They just won't have insurance anymore.
So from a workforce perspective, the demand for healthcare workers continues to increase. So that creates a critical need for workers, but it also creates strong career opportunities in North Carolina. So for the third consecutive year, hospital CEOs have said that workforce shortages are their top concern. So that really underscores the urgent need we have for more skilled healthcare professionals. So in the Charlotte region alone, there are approximately 5 open healthcare positions for every 1 job seeker, which is pretty incredible. So we have seen that as more care shifts to outpatient, community-based, preventative, and home environments, there's a growing demand for a wider range of healthcare professionals and in various skill sets.
So drilling that down to nursing, how many of you have heard of a nursing shortage? That trend has worsened over the years. Shep Center and the NC Board of Nursing predict that by 2033 we would have about 12,000, or we would have a shortage of about 12,000 registered nurses in the state of North Carolina. If you add licensed practical nurses, that number goes up to about 18,000. Several causes, that we can point to today. Burnout. We all talk about burnout. Nurses we're having a sort of a bookend effect where by 2030 in the United States, about 25% of the nursing workforce will retire due to baby boomers.
I would say if you were asked about the most significant concern in oral care in North Carolina at this time is hygienists. So I recently had meetings with Dean Chadwick at ECU School of Dental Medicine, as well as the Dean over at UNC Adams School of Dentistry just in the last month. And at the top of their list, it was, Kurt, if we need to do anything, we need to get more hygienists in this state. Certainly since the pandemic, there's been fewer. And when we all know what happens when you have lower supply but high demand, the cost goes up significantly. So that's the other thing that we're very concerned about, that North Carolina, just in the last census, was the 5th or 6th highest cost per capita for oral care in the United States of America.
think the easy answer to the question of what's the state of healthcare in North Carolina is one word, and that is expensive. And it's expensive for a number of reasons. At one level, the consolidation that's happened, particularly on the facility side, as well as how AI is starting to impact billing practices, we're starting to see a real impact on the cost of care in different markets around the state. But as I spend time at the legislature, work closely with independent insurance agents in North Carolina and the North Carolina Association of Benefit Insurance Professionals, a lot of the observation is that the battle is between providers and insurance companies. But at the end of the day, this needs to be more of a cooperative effort to get everybody at the table to start talking about what we're going to do.
I have seen with my clients massive adoption. So AI is being used for scheduling and billing and transcribing patient encounters and treatment plan compliance and post-visit follow-up and patient communications and clinical support. So just every single way you can think about it being used, it's being used. And AI needs to be a legal and compliance priority correspondingly, to the level of use is the level of risk. So failure to properly implement and monitor AI use within the organization, and especially by vendors, can lead to big litigation and regulatory enforcement issues. I would say third-party vendor management, especially vendors who store PHI, is one of the major issues that I have seen come across my desk most recently. Multiple times in recent months, I've been asked to review a vendor's new AI tool, and it immediately becomes clear that the vendor is actually a single individual who used just some kind of publicly available AI platform. And you can tell right away because the font and the layout and the phrasing of the tool's webpage are all nearly identical. And so what I ask my clients is to consider, do you think this vendor is capable of securely maintaining your PHI? And are they able to satisfy the standards that HIPAA imposes on business associates?